It is 8:21, and today we are talking about, among other things, arthritis is our focus today. And this is Dr. Daniel Morris. He's an orthopedic physician specializing in sports medicine, affiliated with the Walker Baptist Medical Center in Jasper. If you have a question, 741-9272. Good to see you.
Good to be here.
So as a sports medicine physician, what's the most common thing you deal with?
Arthritis is becoming the most common thing that most orthopedic surgeons in general deal with.
Is that a surprise, or is there something different happening, or why is that more?
No, it's not really a surprise. As the population ages and medicine keeps people alive longer, people develop arthritis.
Well, I mean, some people have it younger. I have it in my shoulders. I've had it for years. And is it hereditary? Because my father had arthritis as well.
There's multiple reasons to develop arthritis. Genetics is a big factor. Other things like mechanical issues such as alignment of the joint, weight, infection, autoimmune diseases, rheumatoid diseases, metabolic disorders, multiple reasons to develop arthritis.
And so I think a lot of people may think, too, 741-9272, by the way, is the number to call if you have a question. Do some people think it's a part of aging and they don't realize that it can be treated, and so people kind of live with it until they realize, well, wait a minute, a physician may be able to help me out? Yeah,
people who live with it longer than they need to. Yeah. It can be treated earlier. There is really no cure for arthritis right now, but there are things we can do to help you live with it that's comfortable.
Okay. Well, Terry is on the line. She has a question for us this morning. Terry, good morning.
Good morning.
Hey, what's your question?
Is there a specific test to identify rheumatoid arthritis?
A specific test to identify rheumatoid arthritis? There are multiple blood tests that can be done to help rule in rheumatoid arthritis, as well as x-rays, but there's not one test in general that will give you the diagnosis of rheumatoid arthrise.
Okay, so you just need to find you a good rheumatologist.
Yes, ma'am. I'd find a good rheumatologist today.
So is there like a process of elimination that you end up?
Yeah, usually for rheumatoid arthritis in general, it's kind of a process of elimination.
Okay.
Just the presentation of the patient in general. You know, multiple joints will be bothering them usually.
Okay.
They'll have certain rheumatologic factors in their blood samples that show.
So a lot has to be done before you can get that diagnosis. Yeah. Okay, Misty is our next caller. Misty's on the line. Oh, we just lost Misty. I'm sorry. Okay. Okay, I understand her question, though. When your wrist can go numb, is it usually carpal tunnel, or can that be arthritis?
Usually, if you're talking about numbness, you're thinking about a nerve issue. So it could be carpal tunnel. Now, arthritis might cause some pressure around the carpal tunnel and lead to numbness. So
carpal tunnel is, and usually it happens because people use computers a lot now, and is that what irritates it so much? The
carpal tunnel is just there's a ligament that covers the median nerve. So it can be to anything, really. There's just inflammation around the nerve that causes pressure on it, and that pressure decreases sensation.
Okay, we have Angie on. And Angie's in Birmingham. Hey, Angie.
Hi, how you doing?
Good. What's your question?
My question is, why do arthritis hurt so bad in your knee?
Arthritis in the knee. Why does it hurt so bad?
Well, with arthritis, you get inflammation. So those are, you get swelling as well. There's a lot of grinding sensation. So it's the swelling in general, I think, causes pain. You also get what they call kind of swelling in the bone. The bone doesn't actually swell up, but there's fluid in the bone, and it causes pressure on nerves again and pain.
And there's a lot, we use our knees for a lot to carry ourselves around, and so it usually ends up being, all right, that's our last call, but let's look at, I think we've got some information we want to put up, and look at some of the things folks can do to kind of treatments for arthritis. Reducing stress, what does stress have to do, what does it do with arthritis?
Reducing stress, I don't know if they're talking about stress on the joint itself.
Oh, I got you.
But changing activity. So if you're, weight, like I said, is a big issue. So, the knee in particular has 4 to 5 times the body weight going through it on every step.
Okay.
So if you can reduce, lose 5 pounds, that's 20 to 25 pounds off the joint every time you take a step.
All right, and taking medications obviously prescribed by your doctor. I guess that means don't just start taking over-the-counter stuff trying to figure it out.
You can try over-the-counter stuff like anti-inflammatories. Motrin or Aleve, those things work well. That's usually what the physician will start with anyway.
All right, well, thank you. Thank you very much. Thank you all for calling.